Hi everybody, Neil Kravitz here. I hope you're enjoying these daily clinical pearls. I'm doing this video from New Mexico. I'm about to give a lecture in about a half hour. And I want to review a clinical pearl from a discussion that I had last night with Maz Moshiri. Everybody knows Maz. He is a world-renowned orthodontist who specializes in Invisalign. He's also one of my favorite people. There's not a lecture that I give where I don't mention his name as an example of how to act as a professional. So the discussion was from a paper that I wrote where I said I do not like to use functional appliances on retrognathic patients that have pre-treatment spacing in the lower arch. So if you are retrognathic with spacing in the lower arch, my feeling is that is a surgical case. That case is much more retrognathic than the patient presents. In many ways, the body has already done the compensation. The teeth are usually flared and spaced, and the moment you put on braces and try to retract the teeth, the true surgical grade retrognathia presents itself, and no amount of functional appliance use can correct that. So someone will say, well, can't you just consolidate space and then place a functional appliance? I mean, you can, but this will relapse. The patient will have a dual bite. So I've never had success on patients who are retrognathic severely with presenting pre-treatment spacing. Those patients almost always are left with overjet or require orthognathic surgery with a bilateral split osteotomy advancement to permanently correct the overjet. Let me know if you've seen this in your practice. Let me know what you think about pre-treatment spacing in the lower arch on patients with retrognathia. Thank you guys so much for subscribing to this page. Thank you for supporting the JCO.